Hello and welcome to Aging Matters. This is a show that's provided by and sponsored by the Berks County Area Agency on Aging. My name is Ann Bartlett and I'm the Public Advocacy and Outreach Manager for the agency. Our show today is going to be focusing on falls awareness and falls prevention, since I want to mention that the week of September 23rd to the 27th is designated as National Falls Prevention Awareness Week. And so with that, I want to recognize that there are some issues and concerns that we have, particularly focusing on older adults and falls. And so we want to talk about types of falls, events that cause falls, factors that contribute to falls, other factors that relate to falls, and of course preventive measures so that we can prevent falls, injuries, and changes to our lifestyle as a result of falls. The purpose that this National Prevention Awareness Week states, the mission is to raise awareness about the impact of falls among older adults, promote the message that most falls are preventable, and offer practical solutions to prevent falls. And as a reminder, falls are not an inevitable part or a normal part of aging. So I have some great guests with us today to talk about all the aspects of falls awareness and prevention. So to my immediate left, good morning, Kathy.
Hi, Ann.
This is Kathy Farrell. She is a clinical nurse specialist with Reading Hospital Tower Health. Next to Kathy is Micah Kidd. He is also a clinical nurse specialist with Reading Hospital Tower Health. And next to Micah on the far end is Jennifer Barney, and she's the Injury Prevention Outreach Coordinator for the Reading Hospital Tower Health. So thank you, Kathy, Micah, and Jennifer, for being my guests today. I'm looking forward to a lot of great information that we can share with everybody in our older adult population with regards to falls and hopefully the prevention of those falls. One of the things that I want to start with, and I hate to do this, but I want to start with a statistic. I think that sometimes we can make it important and real and impactful, that kind of maybe makes us listen a little bit more. One of the things that I found from the CDC was that each year there are about 37 million older adult falls and 3 million think about that. Stop a minute. 3 million emergency department visits due to falls. And I think we have another graphic that Kathy or Mike is going to share some information, or both, some other statistics that you guys have.
Sure.
Yeah, I think it's enlightening when we're talking about the impact that falls can have, especially to our older adult populations. Many times people think about the significance of things such as cardiovascular diseases and cancers and strokes and diabetes. And while those all certainly play a significant role in the health of aging adults, it's interesting to learn that the leading cause of injury and of injury-related deaths in older adults is related to falls. So there's quite a significant impact associated to that fall event.
And interestingly, 1 in 4 older adults have a fall-related event each year. And for our own county here in Berks County, our emergency departments and trauma departments are having over 2,000 visits per year, just locally related to fall events. Of that, again, another astounding statistic is there are over 1.2 million falls per year that have subsequent hospital stays. So this is something that is very profound and really could happen to any of us.
And that's the thing, as much as we can say, let's do some things to prevent the falls, it can happen. But hopefully with some of the new knowledge that we have about preventing that in various ways of our own daily lifestyle, maybe we can lower those numbers a little bit, at least locally here, right? So let's start right in. I guess we should start with some of the basics, and I'm going to go back and forth between Kathy and Micah. So the types of fall events, I guess, that we're seeing, particularly that are coming to the emergency, the trauma areas.
Yeah, can I field this first?
You can, sure.
So oftentimes we try to categorize what type of fall was it. So when we talk about falls, we think about, was it a mechanical fall in nature versus physiologic? And what that means is, when we're thinking about a mechanical fall, was it someone's knee buckled and it gave out, or they tripped over a cord in their home environment? So there was some type of mechanical issue that contributed that underlying cause, versus when someone comes in, was it a physiologic fall? So did they have a drop in their blood pressure that caused them to become lightheaded or dizzy, and then subsequently they fell? Because those two different types of falls are going to require two different types of treatment. And so we need to kind of understand the nature of the fall event first. So we do break that out, and then we will adjust the plan of care accordingly. We have great partners in the hospital with our physical therapy program. So if we do need to address any of those mechanical issues, we can address those. We partner with our therapy a lot. And if it's more physiologic in nature, a lot of times there's tweaking of medications that our providers can do to help make sure that those coming in with a fall don't experience those same symptoms when they go home again.
Sure. Some of the injuries that we see coming in through our departments, they can be simple things. They can be bumps, they can be bruises, they can be skin tears, which can be oftentimes treated, and then patients can be sent home. However, some patients need to stay with us. And what we see with this is these hip fractures that are occurring. Sometimes patients will have a fall where they sustain a head injury, and that can be very, very serious. Large populations of our community are on blood thinners, and that is an additional risk for folks if you sustain a fall, to potentially have some sort of bleed, brain bleed, if you will, which again can be very serious. Most, like I said, are typically small types of things, but fractures and brain injuries can occur from a fall. And that's important for us to know, so that people take the fall seriously. They might think, oh, I just bumped my head, I'm okay, and feel fine, but then several hours later something else might be occurring. So don't take it lightheartedly. It's good to have that reviewed and followed up on.
What we can see and don't know, and could be bad. So yeah, we need to make sure we get the treatment.
Sure.
So out of those two examples, Micah, is there one that, are they 50-50 that you see more people coming in with the physiological or the mechanical? I always think, we're all tripping over steps and curves and down steps. I mean, we talk a little bit. I have a Healthy Steps for Older Adults class, which is a fall prevention class. And we will get into environmental kinds of things, but sometimes some of the common notes that people say in the class are things like, I missed the last step. I carry too much stuff, so I don't see necessarily where I'm going. What do you guys see? Is there one more common than another, or both are equal?
We see a very nice mix between the two. I wouldn't say that one necessarily outweighs the other significantly. And I've had the privilege of working with the trauma unit for several years at Reading Hospital. And so we see a lot of those falls downstairs, as you mentioned, missing the last stair. We also see falls related to kind of stepping off of a curb, same mechanism, right? We're stepping downward. We see falls even rolling out of bed is something that we've seen. And so, one of the things that you can very easily do in your own setting is, if you're worried about that, is take the bed in the room in which you're sleeping and position it against a wall, so that at least one side of your bed is protected, and we're mitigating that risk of falling out of bed. So we do see that, but we also see, as I alluded to, some of those patients that have episodes, syncopal, or where they faint, right? Their blood pressure drops, they become dizzy, the room starts spinning, and they end up falling. So we do see a wide variety of reasons that people in our community are falling. But the great news is coming to Reading Hospital, we actually have a level 1 trauma center. And what that means is we're able to provide the care that our community members need without having to leave this area. And so we're really proud of that. So knowing that, as Kathy said, if an event occurs, take it seriously. We have the healthcare team that you need to take care of you right here in our community.
And I think that's great. What you explained earlier too was that depending on the type, you're working with all other entities, departmental and otherwise, to really look at what happened, what was the origination of that situation. So if it was a medication or a vertigo, something that's going on causing that fall, you can really look at that more in depth, as well as maybe then we can talk about the other half more so today is the factors that contribute to these falls, the common falls, the factors, what other things we can do in the key areas maybe within our own environment to make some changes within our homes, our immediate surroundings, to at least better prevent falling at best we can, that we have control of those kinds of things. I mean, we certainly need to be aware that in those physiological things that's not normal. Again, we're going to say it's not normal part of aging, or not normal that you get those vertigo or blood pressure dropping all the time, things like that. You need to be responsible to yourself to make sure that you are seeing physicians or specialists wherever it might be recommended, so that you're managing that. Let's talk about how we can also manage our environment and other factors that you guys have seen. Oh my, they did this one again. We tripped over the same thing again, or whatever it is. What are some of those kind of areas, environmental factors or areas?
So your home environment, you're in it all the time. Obviously, you are used to the environment, but sometimes there are certain things that you might not even pay attention to. You think, oh, I have an area rug as I walk through my door. Things like rugs, the lighting in the home, taking a look around the environment to see, are there handrails, especially in bathroom settings too, can be very preventative. So take a look around your environment, see which is a potential. Do you have rugs? Do you have cords on the floor? Are there things that can be picked up? All those can be what we would consider tripping risks and hazards. Another piece too, with it being summertime, their footwear is very important. So right now, a lot of us are wearing sandals. And the footwear and the choices that you make surrounding the footwear that you are using can be important. You want a shoe that is sturdy and provides good support, something that has a back on it, so that you decrease your risk of tripping or slipping out of your shoes. So those are very simple things that you might take for granted, but can go a long way.
I'm glad you said some of those things. I know that, in some of the people who have mentioned to us, and you observe some people, that particularly in the bathroom, the surfaces are all hard, so if they fall, nothing gives. So you're hitting hard surfaces, sinks, tubs, toilets, floor. Sure. Water could be on the floor that you didn't get to clean up right, because maybe the vision isn't there and you didn't realize there was some water on the floor. Your footwear. A lot of folks who are at their home a lot more, maybe not getting out, I think sometimes they tend to just put their feet in just slip-in slippers, which may, by years of wear, don't have good surfaces anymore. As you said, Kathy, backs on them, so they're maybe not fitting as best as they should. And so to be mindful of those things that really are simple changes we can make. Yeah. What other kinds of areas? I know, again, the bathroom is pretty hazardous to our health. What other ares?
Can I add to what you
Sure,
said,
please.
Kathy? I really appreciate that you called out the home environment is what we may be used to on a day-to-day basis, and that doesn't change. But what does change are the seasons, and those different elements can impact it. So we've had patients that have come in already that were outside working in the snow, shoveling snow, and then didn't take their boots off, stepped into the house on their linoleum floor, their hardwood floor that they're used to, but now with that wet footwear have slipped and fallen and have injured themselves. Same thing we've seen thinking about seasonal changes with autumn approaching. When the leaves fall, when there's rain, that becomes very slippery. So when we've had community members go out to retrieve their mail, and just something that, you know, they're used to all the bumps and where the cracks are in their driveway and their sidewalk, but that environmental factor has changed, and now we've got this slippery surface with these wet leaves. So while you're familiar with your immediate environment, it's important to take into consideration those environmental and those seasonal factors that change that can increase your risk for a fall.
I think some of the things too are habits. You know, we've gotten so used to doing things a certain way, and our habits are there that may be not the safest either. I always think of, I used to tell the story, my kitchen, I used to have a bucket seat in the, you know, for my kitchen table, and the chairs around the table, the bucket seats on wheels. Well, you know, you just pull over the chair, right, to get to the higher shelf for something that you're going to use. Well, you forget, geez, I'm trying to reach up, and my chair's swiveling and certainly can roll away from me. That's not good, but again, you get used to doing that sort of thing, and just someday, that's going to be when I fall off the chair. You know, so I think looking at some of the habits and what those things that we can do also to change them. Don't use that type of chair. Use the proper, you know, step ladder that's built for that for you to use.
That's a good point, definitely. Some of the other things that we might take into consideration around that as well are again with our feet, right? How we have neuropathy. Patients may have neuropathy or nerve damage. Patients may also be suffering from things like heart failure and maybe having swelling in their legs. And being able to keep mobilized and get up and in and out of a chair, to get up and in and out of the house, that is a key point to help every day to mobilize in some fashion to help with their fall prevention.
To do something.
Yep. To help guide their health, get up, move. If you keep moving, you're going to keep moving, right?
Exactly. And so many people, though, because they've been sitting, get up and go, oh, my back, my leg, because they've been sitting. It's not because that's still hurting. It's hurting because they've been sitting. So if we can get our new mindset and habit to, as you say, get up and get moving, even if it's just down the hallway and back, you know, and you know, this and that. So we have some, we want to talk a little bit about some of the common injuries that you've seen, or the severity of injuries that could happen that might also alternate our lifestyle or where we live.
Okay.
Oh, well, we see.
Either are, Kathy.
Yeah. We see a lot of, I tell people we see hips and heads. That's what right, that's what is impacted during the fall, and that's where we see a lot of traumatic injuries, is hip fractures then, or head injuries. Kathy alluded to a little bit earlier with maybe some bleeding, some further down the line, some more impacts that we're not aware of when the initial fall occurs. Some of the impact, though, as you were bringing up, once someone does experience a fall, that decreased mobility is really impactful, and I don't think we realize the impact that it has on our physical strength until you experience immobility. And so what we've learned is that for every 1 day of bed rest, so let's say you're someone in the community and you experience a fall and you have a hip fracture and you're on bed rest for the first day you come in, and then you go to the operating room the next morning, you have surgery, and then you get out of bed later that night. For every 24 hours or so of complete bed rest, they estimate it takes about 3 days to regain that strength. So just 2 days of being stuck in bed from an injury could lead to almost a week's worth of work to get back that strength. So there's a significant impact, and a lot of times folks aren't aware of that until they go through it and experience it themselves, and we work with them. And again, I can't speak highly enough about our physical therapy, occupational therapy partners that help us to get patients up once they've experienced a fall. But that first time out of bed can be really challenging for those patients, and they don't realize it. They're taken back by just how weak and fatigued they can feel from being stuck in bed.
That can occur.
Exactly.
Yeah. So looking at that then, what can we do? I mean, how do we prevent falls, whether it's, the physiological or the mechanical. What can we do? One is obviously keep mobile, right? What would you suggest?
So I think you work with your healthcare team, right?
Okay.
What is individual for you? Are you on a lot of medications? Are you on a medication that may cause a shift in your blood pressure? Are you on an anticoagulation, a blood thinner type of medication? And take stock in what is unique to you. And if there's something that you can talk with your providers about, if you have concerns, if you're seeing weakness, if you're tripping, or things like that, let someone know. And it's okay to acknowledge it because there's things that can be done. Maybe it's a tweak in your blood pressure medication that when you're standing up, you're feeling a little woozy, right? So tell your provider so that they can do a review of your medications. That would be one of the key things that I would stress.
Okay.
Kathy, I just wanted to note, actually 50% of individuals don't tell their provider after they fall. And so maybe it's because it's just like a minor fall and they think it's really not a big deal. So you sharing that, I think, is really important, that they really need to have those conversations with their provider because that can prevent from a larger fall from occurring.
Sure, sure.
Yep. What other things can we do?
The
to prevent falls?
mobilization is key.
Yeah.
Take stock of your environment too. What are your habits? I sometimes think about pets. I don't personally have pets, but sometimes animals and things like that can lead to a slip or a trip too. I was taking the dog out and the dog pulled and I was uneven on the sidewalk or something like that. So just be mindful of your environment.
Yeah, I know that they're pulling you and you're not safe where you were and they all of a sudden moved so you can go down, or the leash or whatever gets wrapped around, they get by your feet. And certainly you mentioned earlier cords, so certainly cords need to be out of the way, not in the middle. We don't need to leave things in our own way. The footwear we can change. Look at our habits. How about even things when we're going back to mobile, we have some opportunities for things to do in the home. We have, I'm going to just mention it real quick, called Get Set Up that we're relating to, that people can call us to get a QR code, or I can tell you how to get online to do some exercises at home, and maybe those can be seated. You can go to maybe sit down and do some leg lifts and things like that on your own in your home after you've conferred with your team to say, yep, that'll work, that'll be good, to keep moving. If you can't, we're not talking going long distances. Some folks who are in apartment buildings, I know, walk hallways. So anything we can do to help build that muscle, build that strength, so that even if we should fall, we're one up on that. We can maybe, help ourselves a little bit better, or the severity of the injury won't
Even
be so
things
bad.
to help promote your balance, right? Different
Exactly.
regimens of exercise, Tai Chi and yoga. Anything that you can build your core can really help you
The
prevent
stability.
your fall.
So I do want to mention that we do have some health and wellness classes that are focused on balance and fall prevention. So you can give our agency a call at the Berks County Area Agency on Aging, 610-478-6500. And now I want to just kind of, for the few minutes that we have, Jennifer Barney is the Berks Falls Free Coalition Coordinator, who happens to be working at Reading Hospital Tower Health. Can you share, we have an event coming up in our community here in Berks County. Why don't you tell us about it, that we're inviting everybody who is an older adult to attend?
Sure, absolutely. So we do have an event. It's on September 19th. Registration starts at 9 a.m. and it's until 1:30 p.m. And we really, all the things that we talked about in regards to things to prevent a fall, we are going to be discussing there that day. And we're going to be offering some free screenings that include balance and hearing and vision, grip strength and circulation. We also will be offering flu shots. So it's really a great opportunity that if you are in question of your health, kind of not sure, to kind of assess your fall risk. And even if you don't think that you're at a fall risk, maybe get some tips or tricks that you can do, some of these reminders that we talked about, some of those things that you can do in the home, checking out the rugs, your medications, all those things that are important. So we have a lot of community partners who are going to be joining us that day. The Alvernia students are going to be offering the screenings as well as our physical therapy. And then we're even going to have the track. So if you are looking for a way to exercise, like we talked about earlier, how important that is, you're welcome to a nice indoor soft track, and the students will be there to assist you. And the other important piece, if you are Spanish speaking, we are going to have several different things that will be there to assist you to help interpret the presentations as well as the screening results.
And I think what's great about having that, it's obviously free, so we're opening it up, focusing on an older adult, maybe age 60 and older, but that the opportunity to try these screenings right there, all of them right there. What we were talking about is then you have that kind of base from that day to take to your healthcare team, whether it's your primary care physician or others that you're working with, to say, hey, here's what I found out. Can we talk about this? Can we open up that dialogue to figure out, is it my medication? Is it my footwear? You know, maybe my bone density needs to be further checked. Things like that that really can start us off right then by taking that opportunity to come there, get that done, gives that springboard to open a dialogue, but also then, as you said, resources, the other vendors, the therapists can also help us with access to what maybe exercises I can do, where are there informal ways to do that in my home, formal classes, what other things, you know, I'm going to learn about the other preventive kinds of things to be able to engage myself, to take that to heart, to improve that, my health, so that I can stay doing what I want to do, living where I want to live, because in some cases, when we looked at those statistics earlier, some of the end results, you know, could be a change of a living environment for somebody, and that's not always what we want. We want to prevent that as well. So gathering all of this information, learning about it, preventing it, and then coming to the event to learn about more. We have about a minute or so. I'm going to turn it over to Kathy, Micah, or Jennifer. What else would you like us all to take away, I guess, from today?
I know for me, I really just want to stress that that medication piece. I know I've shared this with you, Ann, but my dad had a fall related to medication and blood pressure, and so I do think that that conversation between your doctor and yourself is so important to make sure that you're on the same page, because sometimes those medications can change and you and that provider you're not on the same page. And so they think you understand those changes and maybe you haven't. And so it is very, very important to just kind of, we call it the teach back method, but basically make sure that you share what it is that you learned from the conversation that you had with your provider, so that they know that you heard everything that they said.
And don't be afraid to ask questions.
Absolutely.
And get back to them if there's an issue or concern that's causing. Well, I want to just make sure that I re-invite everybody to the September 19th Falls Prevention Awareness event. It is at Alvernia University at the Helen and Tom Flynn Plex. And there is no cost to this. It is free and open. If you want to register ahead of time, that would be great. You can give my agency a call at 610-478-6500. The Berks County Area Agency on Aging can help you to register. And otherwise, we look forward to seeing everybody on September 19th. And I want to thank Kathy, Micah, and Jennifer for being my guests today and sharing this information about falls prevention and awareness. Thanks for tuning in to Aging Matters.